Hello and welcome to Medical Dialogues. I am Dr. Bhumika Makhuri. Let's look at today's top medical news. Can nighttime avocado snack improve heart health? New study says yes. Findings from a newly published randomized controlled trial in the Journal of Nutrition reveal that snacking on avocado before bed may help improve triglyceride metabolism the next morning, a key factor in cardiovascular health. The study highlights the benefits of eating avocado as a nighttime snack, particularly for adults with pre-diabetes, a condition affecting 1 in 3 adults and linked to increased heart disease risk. The research is based on the second meal effect, which suggests that the nutritional content of a previous meal can impact the body's response to the next one. This study investigated how different nighttime snacks influenced metabolic markers in adults with pre-diabetes, with a particular focus on triglycerides, the most common type of fat in the body and a known indicator of insulin resistance. 14 extra steps a minute could improve mobility in seniors study. A pair of new studies from the University of Chicago Medicine, published in PLOS One and Digital Biomarkers, reveal that modestly increasing walking pace by just 14 steps per minute can significantly improve physical function in frail or pre-frail older adults. The researchers also developed a user-friendly smartphone app, Walk Test, to accurately track walking cadence, making this simple health intervention more accessible for daily use. Walking pace, or cadence, is a practical way to gauge walking intensity and is particularly relevant for older adults, many of whom face mobility challenges. Daniel Rubin, MD, an anesthesiologist at UChicago Medicine, was inspired to explore walking cadence as a clinical tool after observing the limitations of questionnaires used to assess surgical risks in elderly patients. In one study, Rubin and his colleagues conducted a secondary analysis of a randomized controlled trial involving frail and pre-frail seniors participating in structured walking programs in retirement communities. Participants were assigned to either walk at their usual pace or as fast as safely possible. Cadence was measured using a sensor placed on their thigh. The results were clear. Music therapy may ease distress for dementia patients. A new study published in Frontiers in Psychiatry reveals that music therapy could offer a low-cost and compassionate alternative to psychotropic medications for dementia patients in NHS mental health wards. The research uses a structured music therapy tool known as melodic to help reduce patient distress. Dementia patients in inpatient wards often experience high levels of confusion and emotional agitation, placing immense pressure on care staff. Current treatment methods often rely on psychotropic medications, which can come with side effects. To address this, researchers embedded a music therapist into NHS dementia wards, delivering clinical music sessions and creating personalized music care plans for patients. Intermittent fasting outperforms other diets for diabetes control, study finds. A new study presented at ENDO 2025 reveals that while all three popular dietary strategies, intermittent energy restriction, time-restricted eating, and continuous energy restriction, can aid in blood sugar control and weight loss for people with obesity and type 2 diabetes, intermittent energy restriction stands out for offering the greatest metabolic benefits and adherence. This study is the first to compare the effects of 3 different dietary interventions, intermittent energy restriction, time-restricted eating, and continuous energy restriction, in managing type 2 diabetes with obesity, said Huhao Zheng, PhD, chief physician at the first affiliated hospital of Zhengzhou University in Zhengzhou, China. The research fills a gap in directly comparing 5 to intermittent energy restriction with a 10 time-restricted eating in patients with obesity and type 2 diabetes. The findings provide scientific evidence for clinicians to choose appropriate dietary strategies when treating such patients. That's all for today. Stay tuned to Medical Dialogues for latest update.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.